Prime Diagnostics is a community-based endoscopy service providing a diagnostic service for general practitioners. It's direct access for upper endoscopy, flexible sigmoidoscopy and colonoscopy. We need a community-based endoscopy service because outcomes for bowel cancer are very poor in this country. Still today, a quarter of presentations for bowel cancer are emergency presentations, which is not an ideal situation. There's also a large number of symptomatic patients who are uncertain and anxious about what is their problem, what's causing their symptoms. By having this facility, which has capacity to meet these demands, we're able to take some of the workload away from the hospitals and enable them to concentrate on complex therapeutic work, but at the same time provide primary care physicians with a rapid, clear diagnosis as to what their patient's symptoms are. Typically, patients will frequently develop gut symptoms, and initially most patients will manage themselves by going to see their pharmacist and self-medicate with advice from the pharmacist. If these symptoms don't respond or they persist, they will then go and see their family doctor. He will assess them and in some cases will decide that he would like an endoscopy to find out what is happening. The patient will then be referred under the old pathway to the hospital for an outpatient appointment, leading eventually to an endoscopy. Under this new pathway, the patient will come direct to their local unit and have their endoscopy. In other words, straight to test.
Prime Diagnostics' biggest innovation really was about 5 years ago to change gastroscopy to transnasal gastroscopy. This is a much finer scope that we pass through the patient's nose that has been numbed pre-procedure. And the huge advantages for this, for the patient, are they don't gag during the procedure, they can communicate with us, and it enables us to look more closely at the back of the throat as well.
Over time, I've been having this problem of ulcers, and it reached a point I felt very bad, very low. I couldn't do my work at my workplace very well because I was having constant headaches, and occasionally I would vomit and vomit blood. So I think these were the symptoms that led my GP to refer me to this place. They've basically been very nice because they've told me everything about the procedure, how long it's going to take, and how it's going to go, the machine is going to go through me and all that. And I think I've got all the basic positive preparations that a patient would have, and I feel very comfortable. And of course, I'm optimistic that the situation is going to help me get better. So I'm quite ready and happy about everything, really.
Prior to arrival at the hospital, the patient will be fully informed about what the procedure is they're going to have and what preparations they need to make. On arrival, they'll be interviewed by a nurse who will again go over the procedure with them, explain what is happening and advise the patient. The endoscopist will keep them fully informed whilst the procedure is going on, and then afterwards the patient will have a full account of what was found and what the best management is. The same day, the GP will get information from us explaining what we found and advising on what would be the best management of this particular condition.
Okay. How are you getting on? How are you feeling? Are you okay?
Yeah, it's all right.
It's okay.
Right.
Good.
Not something for every day.
No. That's gone through your nose nicely, so that's good.
Yeah.
I've come back from the procedure and I feel really, really happy and good because throughout the operation I felt that I was fully informed. The doctor kept me informed, and the procedure was quite fast than I even thought. And so I feel really, really good and happy.
Prime Diagnostics innovations reduce the number of contacts that a patient has with the hospital. The GPs have to refer the patients to the consultant to be seen in clinic, then the test is done, and then a further clinic appointment, which is 3 episodes per test. With Prime Diagnostics sites, the patient's referred directly, has the test done, and then goes back to the to the GP, and all the test results are then sent back. So we reduce it by about 1/3.
I've been to the GP and I've been suffering a lot of acid reflux. When I lay down after a meal, I get a lot of regurgitating, sore throat, really just uncomfortable sort of feelings after a meal, really. It's more the acid, the heartburn, that sort of thing. Went to the GP and he gave me a course of omeprazole, which was a one-off, which settled everything down wonderfully. When I finished those tablets, it started up again. Went back to see the GP and he's referred me to here to have the test. just had the procedure. A little bit apprehensive when it started because although I knew what to expect, I wasn't sure how it was going to be. The doctor talked through the whole thing as it went. Wasn't as uncomfortable as I thought it was going to be. And that was it really. I just didn't feel anything at all. Biopsies were taken and didn't know that was going on. And after a couple of minutes it was all over. It just seemed really quick.
GPs and clinical commissioning groups should refer their patients to Prime Diagnostic community endoscopy units for several reasons. The one is it's much more beneficial to the patient. We have shorter waiting lists so they can be seen much quicker. They don't have to go through the process of being seen in clinic first, they can come direct to test. These are done closer to home in smaller community units where we generally have a lot more time for patients. One of the things that lists our satisfaction scores is that the parking's free. That's always very important to patients and they know where to go. The other big factor, particularly for clinical commissioning groups, is the cost. We run our services under tariff pricing, so we save the clinical commissioning groups money. On top of that, we don't have clinic appointments pre and post test, so obviously that attracts a fee and that will save money as well.
As you've seen, Prime Diagnostics are perfectly positioned to provide an improved patient experience, but also a safe and high quality service that meets all the national standards.